This is Women's Voice, articulating issues affecting women and telling the unique stories of women in our society.
It is yet another awesome day, and welcome to Women's Voice. You might be wondering why I am laughing and beaming with smiles. The conversation for today's topic, or the subject for discussion, has already started. But health experts say back pain is becoming a serious health issue with school children, women, and their families. Back pain and pressure have become a very common and very uncomfortable problem that occurs during pregnancy. Weight gain and the resulting changes in the way you walk, as well as hormonal changes that are relaxing muscles and ligaments throughout your body in preparation for childbirth, can cause back pain levels ranging from mild to severe. This has triggered a growing concern among educators, healthcare professionals, legislators, and parents. Dr. Sasu, a stress management consultant and CEO of Health Works, will help us understand what the issues are when it comes to back pain in pregnancy. Welcome.
Thank you very much.
Back pain. What is it all about?
Well, nobody will really tell you that you have back pain because you will feel it. You will feel it. But back pain is really some discomfort that is triggered by so many factors. It could be a muscle, or it could be muscle strain, it could be maybe one of the vertebrae, pressing on a nerve. It could be so many things, but basically, when you look at the entire back, I'd like to explain it in the layman's terms so that everyone will be able to understand. You see, when you look at your body, you have the skeleton, which the bones, okay? And you see that most of the organs are inside the rib cage here. And then you have the muscles, the tendons, and the ligaments covering them, and then the skin covers them, okay? Now, since we'll be talking about pregnancy and the like, I'd like for you to take a look at the body again. You have the skeleton, and then you have the organs inside, and then the muscles, the tendons, and the ligaments covering it, and then the skin covers it. Now, what normally happens is that maybe through poor posture, okay, through maybe tightness or weakness in your muscles, okay, I'd like you to liken it to a door and its hinge. The door is the frame, and the hinge is what allows the door to be held in place. So it is the muscles which hold the skeleton in place. And therefore, when the muscles are weak, it's like a weak hinge of your door. Okay? You know the hinge of the door. Yeah. When the screws are loose and it moves like this, you see that no matter how much you plane the frame of the door, if you don't work on the hinge, you still have a problem. And so most of the time, people look at the bones in back pain and forget about the muscles and the tendons and the ligaments. Okay? But then in our work, what we have found out is that we have to look at the muscles and the ligaments and tendons and work on them whilst creating an adjustment with the skeleton. And then you get a holistic healing situation when it gets to back pain. And firstly, we say that disease which is non-communicable always starts in the stomach. And I will give you few examples. Like our recent lifestyle makes most people to eat late in the evening. And when you eat late in the evening, your food does not digest very well. And then you will find out that your stomach starts coming out. Okay, people try to wear girdles and other things, but when you look at the shape of your body in the mirror after you take them all off, you see that I don't like this posture, or I don't like this figure. But then what happens is that the muscles have their elasticity. Okay, it is like an elastic band. Now, when the stomach muscles keep stretching and stretching and stretching and stretching, okay, it gets to a point where it reaches its elasticity limit, and then we call it a breaking point. Now, in that breaking point, it's like your elastic in your underwear. You see that immediately it becomes very weak, your underwear begins to drop. It is known as the force of gravity. Okay, so when your muscle, your stomach muscle, which is the core here, okay, when it gets weak and it reaches its break point, okay, then the force of gravity begins to bring everything down. Now, when it is coming down, in your spine, inside the vertebrae, you have discs in your spine, and there are fluids in the disc. So as the force of gravity brings everything down, it begins to press on the disc. And the area which is the most weak, which is in the core area, around the lumbar area, okay, of the back, the small area of the back, along that side, the fluids are pressed out. And then what happens is that the vertebrae sit on one of the nerves, which is the longest nerve in the body, known as the sciatic nerve. And then it begins to cause pain in the back. That is one of the major causes of pain. You see, when you look at pregnancy, the stomach will stretch. Okay? When you look at wrong diet and lifestyle, the stomach will stretch. Now, one of the other ways is also the way we lie down, the kind of bed we are using. But one of the ways that a lot of women find most comfortable, according to them, lying down, is lying on their stomach. Okay, they lie on their stomach. Now, research has found out that when you lie on your stomach and your neck is turned like this, you put a strain, you have a group of muscles going from the back of your head all the way into your tailbone, okay? And it causes 19 different areas of pain in your back.
That is when you lie down?
When you lie down on your stomach.
Okay.
It causes 19 different areas of pain. It can cause neck pain. It can cause pain at the back of the shoulder blade. It can cause mid-back pain. It can cause low back pain. Different types of pain. And it can shoot all the way down to the legs. And yet people say, oh, but that is the way I've been sleeping all the time. Also, our bed that we sleep on. Okay. You see that normally we have wooden planks on the bed and they are spaced. So when you lie on the bed and you put weight on the bed, okay, then the spaces create contours which can also cause pain. So we recommend that you put a plywood, okay, about 1/2 inch to 3/4 inches on the bed, okay. And when you put it on the bed, when you put it on the wooden planks, then you put your mattress on it. You have a very firm surface, and it will help. So no matter, people come and they say, oh, I have orthopedic mattress, and then I ask them, what is the orthopedic mattress lying on? They say wooden planks. I say, well, and you have back pain. Okay, so why should you have orthopedic mattress and have back pain? It's because it's not complete. You see, so if we begin to look at back pain from these points of view, then one, we watch what we eat, we watch so that, and we get into exercises to keep our stomach muscles firm, okay? And then we watch our sleeping position. We have to watch the couches on which we sit for longer periods of time. You see, what most people don't know is that we spend 1/3 of our lives sleeping. Yeah. You see, Rebecca, you sleep 8 hours a day. Isn't it the normal sleeping?
Yeah.
So you have 24 hours. So if you sleep 8 hours a day, it's 1/3. So if you are 60 years, then it means that you have slept for 20 years. If you are 30 years, it means you have slept for 10 years.
10 years.
You understand? So if you keep 1/3 of your life in bed, then the place you sleep must be well structured in that it will not give you problems. You know, but if the place you sleep is not conducive, if it is not okay for your health, then you know what is going to happen. You are going to incur pain. Your body is going to tell you that, look, you've put me in the wrong posture, and it will begin to rebel, and that is the pain that you feel.
But talking about the kind of food we should eat, how does the kind of food we eat cause us to have back pains?
Okay, now let me explain it to you.
Do.
You see, you know that all the sugars that we eat, all the oils that we eat, they all store as fat. Okay? Now, so when they store as fat, and remember that when you eat, you must give your body time to digest the food. It takes averagely about 2 hours for your body to digest the food initially after you eat. So just imagine after a hard day's work, you go home and you eat your main meal. And you know that most carbohydrates tend to sugar, okay, and they tend to fat, okay? So you sit down, you have your bangkung or whatever, you know, and you sit down, and then you begin to watch television, it begins to sing a lullaby, and within 20 minutes you are asleep. It happens to most people, okay? Now you have given your body 2 commands, one sleep and the other digest food. Now which one will win? Sleep will win, because eventually you will sleep. Now when you sleep, your body stops digesting the food, so you have a lot of undigested food mass in your system, okay? If you don't have very good bowel movement, it stores. So you just imagine that, you know, now you begin to have constipation. The food is storing as fat, so automatically the intestines will become bigger, they will expand, and then it will begin to bulge out. And when it begins to bulge out, your muscles will also begin to stretch. Okay, and you have a group of muscles lying from your rib cage into your pubic area. It's called the rectus or rectal abdominis. Okay, it goes in here, and then you have the transverse, which goes like this into the back muscles. And so you just imagine you pull your this thing like this. See, when you pull like this, you see that you are feeling it in the back. And so when the stomach starts coming out, the one that is here, which is going into the pubic area, also joins the thigh muscles. Okay, so you will find out that it will weaken your thigh muscles. You begin to have knee pain. So when you are climbing stairs, you feel a lot of pain in your knees. Now the one going back here, okay, will also begin to weaken, and the lumbar area, the lower back, will begin to be affected. And like I told you, the force of gravity sets in, and then as everything comes down, back pain is the result. So you see what we are doing to ourselves.
So it's a gradual process.
Yes.
Unknowingly,
yes,
we are hurting our own selves.
Yes. You see, and when it comes to like what you announce, pregnancy, of course you have a baby growing.
Exactly.
So if your stomach muscles are already weak, okay, and you have a baby growing in it too, it causes pain. You know, there are 2 types. There is the sciatic nerve type, okay, which can occur when you are pregnant or when you are not pregnant. But there is one which is called the pelvic girdle pain, PGP. Okay, and that one, you know, you see that they say mayasi, and it goes, you know, when it comes, it goes all the way back here, right? You know, that comes because of the weight gain. You know, some people gain a lot of weight during pregnancy because of the weight gain and the chemical changes. You know, you call it hormonal changes, but let's say the chemical changes in the body. Okay, Now, what happens is that it begins to create some pressure down here, and then the pelvis, shifts, okay, and brings about excruciating pain. Sometimes also stress, emotional stress, because of the chemical changes occurring in our bodies. Okay, you see that sometimes pregnant women go through all kinds of emotions,
yeah.
So sometimes if we are not able to handle them very well, okay, the stress creates a lot of demand on our the emotional stress creates a lot of demand on our physiology, and this also can trigger pain in the body.
But as a pregnant woman, having conceived, and you experience back pain, is massage the way to go?
One of the ways is massage, but it is not rigorous massage. In fact, I was in Chicago recently, and I was walking. I like going on early morning walks.
Okay.
And Rebecca, if you have time, you must do that also, because you see, a lot of times we downplay or downgrade walking in terms of fitness, but if you go on early morning walks and you walk very well, I bet you it will also help firm your stomach muscles. But on the walk, I saw a window, and they have from before this, they are written before, during, and after pregnancy, which meant that there is a place where you go to stay fit before pregnancy, and during pregnancy, and after you have given birth to the child. You see, we take a lot of things for granted, and we think that, oh well, I won't exercise, the stomach muscles will not be firm, and as they stretch, it can create problems for you. Now, during pregnancy too, a lot of women sit and they don't do anything. But one thing we have observed with back pain is that sometimes movement helps, to ease the pain. Sometimes. Yeah.
But not all the time.
Not all the time. Depending upon the type of pain that you have, especially if you've been involved in an accident, if something, you are falling or whatever.
Okay.
But with the muscles, if it is a muscular thing, moving helps. And like with the pregnant women, there are little exercises that they can do, that can ease the back pain. Okay. Now, one of the things that they can do is to find a towel, okay, and roll the towel. Maybe you can get a bottle, roll the towel, and put it at the lumbar area in your seat like this, and it will keep, it will jerk your body, and as your body,
the shape,
right,
the right posture,
right, and it can ease the pain instead of slouching in the couch. Get a bottle or a rolling pin, that what the bakers use, a rolling pin, and wrap a towel around it. You can tie the ends so that they don't unfold easily, and then put them at your back. It's an easy thing to do. Now, also, like I was saying, make sure that your bed has a plywood under. If you can't afford the plywood, put the mattress on the floor. Okay? Yeah, sure. Don't be sleeping on couches, because you see,
why?
The couches create all manner of contours. You observe sometimes when you sleep on a couch that when you wake up you feel bodily pains. Yeah. True. Because you see, you are lying down and your body goes into a certain contour, okay, which is not all right. So when you wake up, your body has to remind you that you have punished me. That is the pain. Pain, I read a book sometime, it talked about the brilliant function of pain. It says pain comes to tell you that something is wrong, that you are doing something wrong. So pain is a trigger to let you know that something is going wrong. I must find the solution to it. And when you find the cause for it, you see, most of the time, we don't like to find the causes of whatever it is that we are experiencing, and then we will, bring out all manner of assertions. We think, oh, someone is doing it to me. Look, I have.
And there are some people who even would want to take painkillers almost every time when they experience back pain. Is that the way to go?
No. You know something? A painkiller only masks the pain. Okay? Let me give you, like I shared with you earlier on. If you have a vertebrae, okay, sitting on your sciatic nerve, okay, which is the longest nerve in the body. Now, no amount of painkiller can shift the vertebrae from the sciatic nerve. You need structural adjustments. Sometimes, a lot of people opt for surgery, but I always say that there are ways now. Surgery is all right, but you see, if you do not correct
that anomaly,
after surgery, it will relapse, it will come back. Because you see, the problem is the weakness or tightness of the muscles, the abdominal muscles, and the muscles of the back, which is affecting. So you just imagine, this is what is causing the thing. Or I was treating a prominent person, okay, and he is very late because he's a very busy person. He is very late. So when I said to him, look, sir, the cure to this ailment is stop eating late. He looked at me and he said, look, I've been eating late for a very long time. I won't stop. Okay, he told me to my face. And I said, sir, if you don't stop, then no amount of treatment will, alleviate the problem. Because what is happening is that your stomach muscles are weak. Okay? So we will go have surgery. We'll cut. And when you cut, you just shift the vertebrae from the nerve. Okay? Now, the weakness is there. So what happens? Okay, after a little while, the disc will come down again through the force of gravity, sit on the nerve again. What have you gained? The best thing is to strengthen the stomach muscles, and not only strengthen the stomach muscles, change your lifestyle. Change your, you see, I tell people that sometimes they say, oh, eat breakfast like a king, eat lunch like a prince, and eat supper like a pauper. You see, there is some truth in it, but not always true. If you want to lose weight, then don't eat a heavy breakfast. But for most people, and especially for you women, this is some practical advice, because you always like to maintain your figure. Okay? Look, in the morning, that is the time that you go to the loo, you urinate and everything. Okay? So in the morning, your body is going through a cleansing process. Okay? So you should eat things that will aid cleansing. You see? Then you will see that nature has made it that from 10 a.m. to 2, you see that the sun is at its highest. Okay? And so is your digestive fire. So is your metabolism. So you eat your main meal at lunch. And then in the evening, you eat a lot of grains, especially leaves, like kontomire, salad, and other things. But if you are going to eat kontomire too, not with bayere or kenke or the rest.
In our part of the world,
you see, eat a salad. We grow salad here now.
We do, but it is expensive for the average Ghanaian.
You know something? That is one of the biggest fallacies.
Okay.
I will tell you. Look, every day, every Monday, I go to the market. I go to Agbogloshi market.
Yourself?
Myself. I leave home at 3:30. And when you get there, people have brought all manner of fresh produce, okay, to the market. And then I buy lettuce, spring onions, and other things for salad. Because you see, what normally happens is that, you see the green color of the leaves, they occur through what we call photosynthesis. The trapping of the sun's energy. And you see that the sun is what gives everything energy here on earth. Okay? So it traps the sun's energy. So when you eat the leaves, when you eat them raw, okay, you don't cook them, when you eat them and then you go to sleep, now the energy trapped in there, is exploded, okay, and it rejuvenates your body. Now there is a lot of fiber also, so it becomes like a broom, like prayer, broom, and it sweeps through your intestines, so that when you wake up in the morning and then you drink sufficient water, the water goes in and helps flush it out, so you don't build bad cholesterol deposits in your intestine, because the fiber, the roughage in the leaves, okay, has helped to sweep them clean. Okay, so you don't build up a lot of undigested food mass in your system. This is a simple thing, and it is not expensive. Sometimes I buy 2 cedis worth of salad leaves, and it lasts me the whole week. Okay, 2 cedis worth of salad leaves can last me the whole week. So sometimes, we need to do careful planning. Look, waking up very early one day in a week to see to my health, I think is worth that investment. Whilst everyone is asleep, I'm driving. I don't live in Accra. Okay. You see, I live in Peduasi. So I drive from Peduasi to Abu Blushi, and I buy the salad leaves. You see, so we must, we must try our possible. Yes, we must make a conscious effort to stay healthy. You see, health. I traveled to a place called Beauty Exchange in Guangzhou in China, and when you go there and you want to be beautiful, they can do everything for you to be beautiful, but it costs money. so it doesn't come like that. It takes some effort, So when you see people who are fit, they invest in their health. We say that your muscles, you either use them or lose them. You understand? Yeah.
Okay, but for a pregnant woman, for instance, if the person experiences back pain and let's say the pregnant woman is put to bed, she delivers after everything, does that have any implications, or would the woman have any complications?
Yeah.
And how about the baby?
Yes, you see, what normally happens, and it's been something that we have been observing. Sometimes some people have the natural process, and sometimes they have cesarean. Okay, now you see, when you have a cesarean, it means that this area is cut, and then the baby is pulled out, and then it is sutured. We say it is sewn back. Okay.
Stitched.
Yeah. Now, when they remove the stitches, because it has been opened and joined, okay, we have a certain technique that we use to remove the pain, because you see, you will be injected, and the place will feel numb, but your subconscious mind knows that something has happened. So you have an area here which is weak, and it will hide pain. So we take the pain, and then sometimes what we do is that, castor oil. Castor oil. Yeah. We find a flannel or like a piece of cotton, and sometimes use the what we call singlet of men, or t-shirt of men, but cotton, and then we soak it with castor oil, and then you put it on your lower abdomen, and you put a bit of plastic on it, and you find a hot water bottle, and you put it there, and it helps to soothe the pain there and to remove the pain. Before, after that, you have to wait for 6 months before you start rigorous exercise. So if you cannot do the rigorous exercise after a C-section, walking is the best. It helps to tighten the muscles. But sometimes people will just be complaining about the pain and not do anything about it. And when it stays for a longer period, okay, it becomes chronic.
But isn't it because they don't know about it, or like
that is why we are having this program.
Formal knowledge.
That is why we are having this program. You see, you know something? I have always said that one of the things which motivated me, okay, to study back pain or
human anatomy in its
and all
entirety.
You see, my mom used to have a lot of knee pain. And all her friends, like they would say, oh, I've reached the age where I have knee pain. And I said to myself, whatever causes knee pain, I'll find it out.
Okay.
You understand? You see, what I mean is that we must be interested in our well-being, that we invest, try to find out, look, this is my body. This is what God has given me. It's like the vehicle I have to work with during this lifetime. Okay, so I must keep it. Look, a lot of people take good care of their cars more than they take care of their bodies. You understand? But you must know that, look, this is what you have to run through. As for the car, you can go and get a 2014 car, or, you understand? But as for your body, so you need, even though the cells are changing constantly, you need to reprogram the body all the time, so that even though the biological clock will say that, oh, you are X number of years. When some people ask me, I tell them I'm so many years young. I don't tell them I'm so many years old, because I don't feel my age. I don't feel my biological age, because I always invest in my well-being. So it's something that women must take to. But fortunately, in recent times, a lot of women are taking to exercise, but sometimes only during the weekend. Because during the weekend, when I'm coming from the mountain, you see a lot of people
descending down.
Yeah, I have a friend. I have this friend, Oheniba. He does some program on Oman FM, and he consciously gathers people, and they walk. They go to the foothills of the Aburi mountain, and they walk up and down. And you see a lot of women doing that, and sometimes when you come in, you see nowadays, Saturday and Sunday morning, you see people singing and walking, and they going from so many places to the beach to exercise, on this overhead bridge, in Nkrumah Circle area, overhead bridge. You see a lot of people. If you walk, if you pass through those areas, you see a lot of women, But the thing is that it is not only the exercise, it is smart eating, and not eating, look, in the evening, don't eat bread. Yeah, don't eat bread in the evening. Don't eat any wheat product in the evening. No Indomie in the evening. Because they will all store as fat. Okay? And you see, because most of them also, the starch has been removed, most of the whites. So, a colleague doctor says that refrain from all the whites in the evening. No bread, no gari, no yam, no, you understand?
All the starchy foods.
Leave
And
them.
for Ghanaians, most of our foods are starchy. So, but let me
Eat them in the afternoon.
Amazing. For some of us who work our work takes a lot of time. We spend most of our time at work and all of that.
Rebecca, what time do you get to work? I'm going to tell you something.
As early as my work demands.
As early?
Yes.
Like about what time?
Like about 6 a.m. or 6:30.
Good. All right. And you see, I also do the same. I start work at 6 a.m. Okay? Now, because of smart eating, I eat fruits in season in the morning. I drink water, eat fruits in season, I eat my main meal in the afternoon. In the evenings, I have a salad. And this is this is something that I've been doing for the longest of time. You know, I have a lot of friends who, when I was doing this, they thought I was weird. Okay? But you know,
but in the long run,
yes, they all, no. In the long run, they are all changing. You know why? Because they will be sick. And when they go to the hospital or they want to lose weight, or when they go, they tell them that, oh, you have to change your eating habits and eat this way and eat that way. And then they will come to me, oh, so now I want to listen. How should I eat? I said, well, what I've been doing that you thought was weird is the best way. You know, so don't think that you are doing something to harm yourself. Discipline is not punishment, it is training. You know, and they say practice makes perfect. Initially, because the mind is a creature of habit, when you have a bad habit and you want to break it, it's difficult. But with persistence, you know, I think I can, small. You see that one day you have reached the goal. Yeah.
Okay, but treatments, treatments for back pain for pregnant women, are they the same or similar to any other person suffering from back pain?
Well, you know, firstly, you don't massage the stomach. You know, you don't. When I say you don't put a lot of pressure.
Why? You may have miscarriage.
If the person doing it, you know, the reason why I'm saying so is that you can say, oh, massage. This is a public. We are speaking with the public. Okay. You say, oh, massage will do. Someone will say, okay, hey, what the doctor is saying? He say massage. Lie down. Let me massage you. You know, and it can bring problems. Okay. But there are ways of, you know, massaging the stomach. There are exercises that one can do, but you must seek. You know, I had wanted to demonstrate an exercise, but I was very cautious. I said, no, I do it, and the person does not do it well, I will be blamed.
Okay.
Okay. But if the person on one-on-one, okay, I can tell you, okay, do this, and I'll supervise and make sure that you do it well. Okay, but there are exercises, there are massage sequences of the lower back that can be done. I've had several pregnant women come over and they feel good after, you know, the girls have given her a massage, because you cannot, it's hard to adjust the spine when, you know, the stomach is bulging, you know. So there are ways of going about it. So people must seek expert advice when it comes to massage and, you know, physical adjustments, structural adjustments, and all that. It is very important.
But why is it that for pregnant women, usually it is said that they experience back pain during the second half of their pregnancy? What happens? Why is it just the second half of their pregnancy?
You see, you have a fetus growing. Now it's creating a demand on the body. Okay. You see, if you know about how stress works, anytime a demand is made on our body, our our body, you know, we call it, we have a name for it, that in Krama. Okay. You see.
And that one is what?
Okay. It's Akan and I think Ga too.
Okay.
You see, what normally happens is that anytime a heavy demand is made on your body gets into what we call the fight or flight response. Okay. It secretes chemicals in your body to help you run or fight. Okay, you run away or you stand and fight. But it's all energy that is being expended. But most often times we don't. And what happens is that some of these chemicals are released by the adrenal glands, which are on top of our kidneys. They secrete these things, and so when they keep on secreting and we don't run or fight, okay, then what happens is that it weakens the kidneys, and kidney weakness also can cause back pain.
It is a whole
topic
on its own.
Yeah.
But does every back pain require immediate medical attention?
You know something? If you have pain and you don't know what the cause of the pain is, find an expert in that field for the person to diagnose what you have. Then it settles your mind. Look, Rebecca, I have had so many people. Sometimes some people even think that someone has given them the evil eye, someone has cursed them, someone has jujued them. I've had pastors come to me who feel that, maybe someone in their church has put something, and I tell them that, look, my brother, it is nothing. This is what is happening. And, perhaps they would have gone to so many places. But, you see, we have mechanics, okay? You have TV mechanic, you have bicycle mechanic, you have car auto mechanic, okay? Now, if your TV spoils and you send it to a bicycle mechanic, if he's a the fact that he's a mechanic doesn't mean that he's a TV. So you have to find an expert. Not every medical doctor specializes in back pain, and that is what most people don't know. So you have to seek someone who has specialized, who knows about back pain. There are people, if you don't seek for those people, you will not find them. Okay. And that is what the advice I will give to most people. Seek proper medical attention whenever you have back pain, because you never know. See, one time, a gentleman came with some back pain, okay? And, I knew that after about 4 sessions, he should be all right. About the 4th session, I told him, no, I think this back pain is more than just muscles. He went for, so I told him to go for a scan, okay? And what happened? He had cancer. You see, the pain was that of cancer, but he didn't know that. And so it is very, very important that we seek expert medical attention when we have back pain, so that our minds, okay, will be at peace when we know exactly what is happening.
What are the risk factors?
risk factors, yes, in going to, you see, let me tell you this. I always tell people, and my surgeon brothers should not be angry with me, unless a person has been involved in a severe accident, surgery should always be the last resort. It's very, very good, but sometimes if the main, the causative factor is not corrected and you do the surgery for back pain, it will return again. So like I said, we should be very cautious. Surgery sometimes is the only way out also. Sometimes surgery will be the only way out. So it depends. There must be proper diagnosis, okay, proper evaluation of the situation. You don't have a one-size-fits-all thing, So if you have an honest person who will tell you that, look, seek this, yeah.
But when it comes to the treatment of back pain for pregnant women, does all the treatments, does it go for everybody? Sometimes with the same condition? Or it varies?
Yeah, people
even
are
with
different.
Similar or same?
I will tell you. We have, in my field of medicine, which is Ayurveda, it is life science, it's an ancient, a natural healing system, okay? But we have married modern technology with ancient wisdom, and so like we use a lot of modern stuff. What Ayurveda teaches is that we have different body types, okay? So your body type would determine the kind of treatment that should be given, even the intensity of the massage sequence. Okay, so that is why I talk about an expert, because then if you come, the type of oil that will be used for your body when you are pregnant will be different from the type of oil which will be used for another person, because of your particular constitution. So if, like I say, okay, it's like how people, I've been telling people, in Ayurveda, their massage is known as abhyanga, which is translated means anointing. Okay, in the Bible, they say when you are sick, go to the elders and let them anoint you. Okay, but you see, what most people don't know is that in Rome and Greece, where you have Christianity passed through those areas, and St. Paul, who says so, lived in those areas. He knew about massage and things. Okay, so abhyanga, or that oil massage, is what they are talking about, because people go and they drink anointing oil and all that, and nothing happens.
Oh, okay. But Brenda, how do we deal with or prevent or alleviate back pain during pregnancy or even after pregnancy?
Yes. One, before pregnancy, exercise. During pregnancy, also go for walks. Don't live a sedentary life, and also the bed on which you lie on, the chair on which you sit. You must take good care of all of these things. Take note of all of these things, and also the food that you eat. Because remember that this is stretching. If it overstretches, you'll be having problems. So we say that it is better to prevent than to cure. You understand? So if you take the preventive measures, then the less likelihood of you getting a lot of back pain.
Wow. This has been very educative. Let me remind you that when you were speaking about Paul and all of that, and I remember that Dr. Sasu himself is a reverend minister. I forgot to add that title. Sorry about that from the initial stage.
You know something? I tell people that during the weekdays, I'm a doctor. Weekend,
you are a pastor. Oh, that's interesting. All right, so it has been Women's Voice. Today we have been discussing back pain in pregnancy with a stress management consultant and a reverend minister of the Gospel of Christ. He is Reverend Dr. Samuel Sasu. Thank you so much for being a part of this program. Make sure you catch us live on Facebook, and please do well to send in your comments through our Gmail account as it rolls on your screen. My name is Rebecca Ewa. Thank you very much. We'll see you same time tomorrow.